Hi, my name is C.Bertolino and I am a FNP student at Maryville, and Jana is my patient today for the eyes, ears, nose, and throat exam. So we're going to start, actually before she came in, we did the Snellen chart for distant vision, which was fine, and we did the Rosenblum chart for near vision. So next we're going to do the confrontation test. Test for peripheral vision. She's going to tell me when she sees my hands. Okay, and then next we're going to move on to just visually looking at the eyes. I'm going to look at the hair distribution of the eyebrows and make sure that the distribution looks fine, that it extends to the temporal canthus of the eyes, and the eyelashes are distributed nicely as well, and they fan out as well. Then I'm also going to go ahead and palpate her orbits and make sure that there's no pain and I don't feel any nodules and no swelling. Next, I'm going to have her open and close her eyelids, and while she's doing that, I'm going to check and make sure there's no ptosis and that there's no, I'm actually visually looking to make sure there's no flakiness, redness, swelling, or discharge. Next, I will go ahead and examine her conjunctiva. I will pull down on the lower lid and check and make sure that they're nice and pink. I'll also be looking at the lacrimal ducts and make sure that they're nice and pink, there's no discharge. I'm also assessing the sclera to make sure they're nice and white. I don't see any foreign bodies. Next, we will assess the other visual test. We're going to assess for her corneal acuity, and we're going to have, I'm going to check for light accommodation. I'm going to have bring the pen light in, and I'm going to make sure that her pupils react both to the light. I'm also going to check her pupils and make sure that they are round, they react to light, they're equal, and accommodate as well. Next, I'm actually going to stick with the pen light, and we're going to check her extraocular movements. I'm going to have her keep your head straight, and I'm going to have you focus on the pen light, and you're going to just follow the pen light with your eyes. This is the six cardinal movements of gaze. We're actually go in as well to check for accommodation. Next, we can take the ophthalmoscope, and we're going to look deeper into the eye, and we are going to look at the lens and the cornea, make sure that the optic disc is nice and round, that the vessels look intact, that there's the red reflex, and all of that looks good. One other visual test is the cover-uncover test. I'm going to ask the patient to cover one eye, and she's going to tell me when she sees the number in her field. 2, 3, 2. Okay, and we'll do that. We would do that on both eyes. Next, we're going to move on to the ears. I'm going to inspect the auricles and make sure that I don't feel any lesions, that I don't feel any nodules. I'm also looking to make sure I don't see any drainage, flakiness. All of that looks good. Next, I'll take the otoscope, and I'm going to look into the ear, make sure I don't see any serum buildup. I'm going to look for the bony landmarks and make sure that those are visible. No drainage noted. I'm going to look for the tympanic membrane and make sure that it's nice and pearly gray. Which that's visualized as well. Next, we'll do the hearing test. I'll take the tuning fork, I'm going to strike it, and this is the Weber test. She's going to tell me when she no longer hears it.
Okay.
Okay, and then I also will strike it again. I'm going to put it on the mastoid process. She'll tell me when she no longer hears it. And I'll strike it again, and I will put it near her ear, and she'll tell me when she no longer hears it.
No.
Okay, and the air conduction is twice as long as bone conduction, and so you should pay attention to the clock when you're doing that test. The final hearing test is the whisper test. You should stand behind the patient, whisper a word, apple,
apple,
and she should tell you what word you said. You're also assessing during the entire history for her hearing. Next, we'll move on to the nose. We're just going to visually look at the nose, make sure that it's symmetrically placed. We'll look inside the nose and make sure that we don't notice a deviated septum, that the mucosa is nice and pink, no drainage noted. Next, we'll ask the patient to cover one nair and breathe, and do the same for the other. Okay. And we're checking for patency there. Next, we're going to palpate her frontal sinuses and her maxillary sinuses, and she's going to tell us if she has any pain, and we're also checking for any edema that may be present. Okay. Next, we're going to move on to the mouth. We're going to look at our lips, make sure that they're nice and pink. We don't see any fissures. We're going to have the patient open her mouth, and we are going to make sure that her gums are nice and pink, that her teeth are nice and intact. We don't see any caries. There's no plaque buildup. We're going to ask the patient to stick out her tongue and say ah. We're going to look at the uvula, make sure that it's nice and centered. We're also going to look at the hard palate and make sure that it's intact and nice and pink. We're going to look at the gingiva, make sure it's nice and pink and we don't see any edema or swelling. We're also going to check for the cranial nerve 12. We're going to ask the patient to puff her cheeks, clench her teeth, stick out her tongue, squint her eyes, and smile, and then squint her forehead. Okay, and that all looks good. We're also, while we're examining the mouth, we're going to look at her tonsils. If she has any tonsils, make sure we don't see any exudate. Check to make sure we don't smell any odor. And then the final test would be the gag reflex. I will take the tongue depressor and just initiate the gag reflex on the patient. Make sure there's a gag reflex. Okay, that concludes the assessment. Thank you.